welcome back. Well, we have Dr. Teymoorian here, otherwise known as Dr. T, who is here from Harvard Eye. Well, welcome. Nice to have you here.
Well, thanks so much for having me. Everyone, hello. Hope you guys had a great weekend.
That is great. And, you know, it's been so long. I mean, we've been doing an awful lot of Zooms with Dr. Hovannessian, and now we're glad that now we're going to start to meet all of you. And you just said you have 17 doctors in there.
We have a lot of doctors. So much has changed, and I'll be the first one to say we're so excited to be able to come back in studio with you guys. So we'd love to be here and sort of show off, you know, all the different talent that we have. Absolutely.
Yes, and everybody does do something different over there, which is really awesome. Tell me a little bit about yourself. Like, how long have you been with Harvard Eye? Where did you come from?
Thank you so much. Yeah, I can't even believe it. It's been 10 years now that I've been here at Harvard. I did my glaucoma fellowship at Stanford. I did most of my medical school and undergraduate training, business school training at UC Irvine, so I'm very familiar with South Orange County. It's my home away from home, and now it's my home officially again.
Oh,
so
that's
great to be back.
That is great. So 10 years, and you specialize in glaucoma or cataract. I mean, how does it go?
That's a great question. I specifically focus in on glaucoma, but I also do cataract surgery as well.
Okay.
And people always say, how are those two things sort of linked together? Glaucoma is one thing, cataracts is another thing.
Yeah.
But that's really what I wanted to talk to you about today, is that whole idea of interventional glaucoma. It's a different way of treating glaucoma. It used to be, we only had a few options for our patients. You either had eye drops or you had big surgery. I'll admit it, I'm a big pizza fan. It's sort of like being only able to offer patients a cheese or a pepperoni pizza. Now we have a whole host of toppings we can provide for our patients. The question is, how do we put them all together? Basically make the type of pizza that's the patient really wants.
Right.
So that's how cataract surgery comes into place. You can actually utilize cataract surgery to bring the eye pressure down to help manage glaucoma. They actually go hand in hand together.
Okay. You know, it's interesting because I've talked to so many doctors over the years, and all they were talking about for the longest time is precision medicine, right? Well, you do it for cancer and you're doing it for all these other situations. And here you are customizing eye surgery for each individual.
Yeah, and that's the beauty of it. We really get to individualize it based upon the person's needs. We don't just have to say, we only have two options, this is all we have. Every patient's different. You know, some people, certain activities are important. They like to play pickleball. They like to read, and we know that's really important activities here. Other people don't do that. They want to do other things like travel. The beauty of what we get to do is we really get to meet our patients, understand what their wants and needs are, so we can then tailor what exactly we're doing surgically or interventionally to get them there. It's all this idea of improving quality of life, right?
Right.
We want to get you towards the end of your life doing exactly what you want to be doing and being happy. And our job as your vision guardian is to do what we need to do to make sure we get you there.
So talk to me a little bit about, you have a philosophical shift in glaucoma care, which is basically what you're telling us now, but give us kind of a scenario, like you talk about reactive and patient-centered to proactive and physician-centered. So what's the difference?
Yeah, you know, if you ask 100 patients or glaucoma patients, how do we treat glaucoma, they'll most routinely say it's eye drops. And that was true about 10, 15, 20 years or so ago. That was really the only option we had, or we had big surgery.
Yeah.
The problem with that is it puts a lot of weight and responsibility on our patients. And it's not that we don't trust our patients to get their drops in, but it's not that simple. Patients have to be able to get their medications, have to be able to remember them, have to be able to put them in. They have side effects with redness or irritation. Patients simply cannot get that done. It's difficult, but that was the only option we had. It was a very patient-centric approach.
Gotcha.
Now with these newer interventions that have come out, lasers, injections, cataract surgery, additional glaucoma surgery, we don't have to put the responsibility on the patient. We can put it back on the physician. Let me guide you in this journey of glaucoma, and then let me assume that responsibility for you.
Right.
When you look at our glaucoma studies, because we like to do everything medicine-based and evidence-based, is there's two things we need to do for glaucoma. You want to bring the eye pressure down, and you want to keep the eye pressure down.
Okay.
Eye drops simply don't allow you to do that because of the hurdles our patients face. And I always like to think about glaucoma as taking a patient on a glaucoma journey in life. My job is to take them from point A, which is right now, and get them to point B, which is the end of their life. And I want to get them there with really good functional vision.
Gotcha.
So we can maintain a high quality of life. The question is, how do we get past those obstacles which we're naturally going to hit along the way,
Yeah.
so we can get them to that last place?
But it's something that you can tailor along the way, right? So you say, okay, here's what we're going to do now, and then maybe in 3 years from now, we'll have to revisit and do something different. So when you say that it's a journey, so how many different things would you imagine they would have to go through?
And that's a good question. Everyone's journey is going to be different.
Okay.
You know, we always try to cookie cutter care, sort of like a black and white approach. In glaucoma, you have to be okay with gray. You know, the question is, how long is this journey going to take? I'm not sure, because I'm not sure how long we're going to be taking care of you.
Right.
So you have to be somewhat okay with being flexible and deviating from the journey. It's just like if you're going on a safari somewhere, sure, your tour guide knows where to go, but sometimes you need to make a little bit of a change here and there.
Right.
The beauty of it is, though, we have options, though. We don't only have to stick with eye drops and surgery. There's
Right.
other things we can do to get you the best journey that you need.
Right.
And that's really where that philosophical change becomes important. We can tailor that to what the patient needs.
It's an amazing situation, and you know, hopefully people will feel, like you said, less stressed about the decisions that they would have to make with their vision. And we've talked to Dr. Hovannessian a number of different times, and he's always talking to us about the technology. And technology is changing so fast now that you're able to provide so much for everyone.
Yeah, and one thing I hate is when people are so concerned about their vision, they get stressed out about it, and people already have enough things going on in their lives. I would say, leave the vision responsibility and worry to me and go live your life. You know, sort of allow me be the chef in the kitchen. We'll sort of build things as we go. And the more patients sort of let go of that and sort of let me guide them, the easier the process becomes. But you have to be okay with sort of letting the chef do their thing.
Well, right. And how many times do we want to just have our hands in all of that and say, oh, no, 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 let's do this, let's do that. But that's traditional.
Of course.
Right? Most people who are at the age that they're at now, who are probably coming to you, have been set in their ways for a long time. And because the technology has been moving so fast, it's a little harder for them to understand.
Absolutely. And I love it, though, when patients read things online, because they ask really good questions about it. It's just a matter of balancing what you read online, what's true and maybe not so accurate, with what's available for the patient. Because it's not just a matter of, hey, we have this technology, but do you have access to this technology too? And how do we put all those things together?
Perfect. Well, Dr. T, as you have asked me to say who you are, we appreciate the information. Thank you.
Of
and
course.
It's just wonderful to know that you guys are all there for everyone.
Absolutely. Thank you so much for your time. And again, if there's anything we can do, please feel free to let us know. And you guys all out there, have a wonderful day.
Thank you. And of course, if you want more information about anything that Dr. T has mentioned here, or if you want to know all about Harvard Eye, you can certainly call them at 949-951-2020 or go to harvardeye.com. We'll be right back.